the roots, trunks, divisions, as well as the chords of the brachial plexus. Now let us discuss about the various branches of the brachial plexus which are arising from the roots, trunks, as well as from the chords. First, let us discuss one by one. In the beginning, I will explain you about what are the branches which are arising from the roots of the brachial plexus. In spite of giving small segmental branches directly from C5 to C8 to the muscles which are present at the neck, and also contribution to the formation of the phrenic nerve from the C5, the roots of the brachial plexus, specifically the C5 root of the brachial plexus, is responsible for giving one branch, and C5, C6 as well as C7 roots take part in the formation of the second nerve. So which means by this I want to tell you that there are totally two roots arising from the brachial plexus, that is from the roots of the brachial plexus, in spite of small segmental branches which are given off to the muscles of the neck from C5 to C8, and also after the contribution of the formation of the phrenic nerve from the C5 root, the roots of the brachial plexus gives off two important nerves. So let us see what are the branches which are arising from the roots of the brachial plexus here. So if you say this is the first branch arising from the roots. You know that this is C5, this is C6, C7, C8 and T1. So the C5 root of the brachial plexus gives off a branch. This is called as dorsal scapular nerve. So what is the first branch? It is called as the dorsal scapular. So the name itself implies that the nerve is related to the dorsal aspect of the scapula. So the dorsal scapular nerve arises from the C5 root of the brachial plexus. So immediately after the origin of the dorsal scapular nerve, it pierces the middle scalene muscles. Remember, we studied in our previous topic that between the anterior as well as middle scalene muscles, the brachial plexus enters into the posterior triangle of the neck, right? So in the same way, the dorsal scapular nerve also passes posteriorly, because anteriorly you have the anterior scalene muscles and behind you have the middle scalene muscle. So immediately after the dorsal scapular nerve arises from the C5 root of the brachial plexus, it passes posteriorly. By passing posteriorly, it pierces the middle scalene muscle, that is the middle scalene muscle in the neck, and after it pierces the middle scalene muscle in the neck, it passes posteriorly along the medial border of the scapula. It passes posteriorly along the medial border of the scapula. You know that in the dorsal aspect of the medial border of the scapula is related to the two muscles. One is called as the rhomboides major and another one is called as rhomboides minor. So by passing along the dorsal aspect of the medial border of the scapula, this dorsal scapular nerve gives innervation to these two muscles called as rhomboides major as well as rhomboides minor. So at last I want to tell you that the dorsal scapular nerve arises from C5 root of the brachial plexus. It passes posteriorly, pierces the middle scalene muscle and runs backwards along the medial border of the scapula, where it innervates the rhomboides major and rhomboides minor. So these two muscles, rhomboides major as well as rhomboides minor, are responsible for the retraction of the scapula. So what is the function of the rhomboides major and minor here? They are responsible for the retraction of the scapula, right? So by this, I finished the first branch of the brachial plexus, which is arised from the C5 root. Now coming towards the second branch arising from the roots, called as the long thoracic nerve. So this is called as the long thoracic nerve. If you see the long thoracic nerve, it receives a contribution from C5, it receives a contribution from C5, it receives a contribution from C6, and also it receives a contribution from C7. So this is the long thoracic nerve. This is the second branch arising from the roots of the brachial plexus, called as long thoracic nerve. This long thoracic nerve is formed by the anterior primary rami of C5, C6 as well as C7. So what is the root value of long thoracic here? It is C5, C6 as well as C7. What is the root value of the dorsal scapular? It receives the fibers directly from C5 only. It does not have a contribution from any other part of the spinal segment. That is the reason the root value of the dorsal scapular is C5 and the root value of the long thoracic nerve is C5, C6 and C7. So you can see here, immediately after the formation of the long thoracic nerve, it passes vertically down the neck. It passes vertically down the neck. So now after it passing vertically down the neck, it reaches the axillary inlet. So from the axillary inlet, it reaches the medial wall of the axilla. So what is the course of this nerve? After the formation of the long thoracic nerve from the anterior primary rami of the spinal segment C5, C6 and C7, it passes vertically downwards. From there, it reaches the axillary inlet. From the axillary inlet, the long thoracic nerve reaches the axilla. In the axilla, the nerve is related to the medial wall of the axilla. You know that we studied in the axilla topic that medial wall of the axilla is formed by the serratus anterior muscle, which means after the long thoracic nerve reaches the medial wall of the axilla, this nerve runs superficial to the medial wall of the axilla, which means this nerve runs superficial to the serratus anterior muscle. So that is the reason whenever you are doing dissection, if you see the serratus anterior muscle immediately superficial to the serratus anterior muscle, you can clearly see the nerve called as the long thoracic nerve. So the long thoracic nerve is related superficial to the serratus anterior muscle, and this serratus anterior muscle has some of the important actions. The main important action is the serratus anterior muscle along with the pectoralis minor. It is responsible for the punching as well as pushing movements. For example, whenever you are pushing the wall against the resistance, whenever you are doing any punching movements, the retraction of the upper limb is mainly done by the serratus anterior. So serratus anterior muscle along with the pectoralis minor is responsible for the pushing as well as the pushing movements as well as the punching movements. Not only the pushing as well as the punching movements, the serratus anterior is also responsible for the overhead abduction of the arm. For example, if you see the abduction of the arm here, you know this is the movement is called as the abduction. For example, abduction can be explained in three different ways: 0 to 15 degrees, 15 degrees to 90 degrees of abduction, above 90 degrees. For example, if you see from 0 to 15 degrees, this is mainly done by the supraspinatus. The supraspinatus muscle is responsible for the abduction of the arm from 0 to 15 degrees. From 15 degrees to 90 degrees of the abduction is mediated by deltoid, right? So by this we can say that from 0 to 90 degrees of the abduction is done by the supraspinatus as well as deltoid. And from 90 degrees above the head is called as overhead abduction. So the overhead abduction of the arm is performed by the serratus anterior muscle. So whenever you can see the injury to the long thoracic nerve which can causes the paralysis of the serratus anterior muscle, the paralysis of the serratus anterior muscle, whenever the paralysis of the serratus anterior muscle is seen, the pushing as well as the punching movements are deficient. You cannot able to perform the pushing as well as punching movements. Not only that, the overhead abduction of the arm cannot be possible, right? The arm can be abducted only up to 90 degrees. Why? Because deltoid is normal. If deltoid is normal, the arm can be abducted up to 90 degrees. But above 90 degrees, you need serratus anterior muscle. So, not only the serratus anterior muscle is performing the overhead abduction alone, the serratus anterior muscle along with the trapezius is actually responsible for the forward movement and the rotation of the inferior angle of the scapula. So whenever there is a forward movement and the rotation of the inferior angle of the scapula, the glenoid cavity is directed upwards. So because of the glenoid cavity is directed upwards, the overhead abduction of the arm is possible. So remember one important point here. The serratus anterior muscle along with the pectoralis minor is responsible for the pushing as well as punching movements. Second point, the serratus anterior muscle along with the trapezius is responsible for the overhead abduction of the arm. So, discussing further detail about the serratus anterior muscle. Serratus anterior muscle is actually attached to the medial border of the scapula from superior angle to the inferior angle. Where is the attachment of the serratus anterior muscle towards the scapula? It is attached from superior angle to the inferior angle. It actually arises from the 8 digitations from the upper 8 ribs. After it arises from the 8 digitations from the upper 8 ribs as well as the fascia, it runs medially as well as backwards. Finally, it attaches to the medial border of the scapula from superior angle to the inferior angle. So whenever there is a paralysis of the serratus anterior muscle due to the injury of the long thoracic nerve, the medial border of the scapula becomes unduly prominent. Not only the medial border, because the fibers are also attached to the inferior angle of the scapula. So the medial, for example, if you see the scapula in normal individual, the medial border, for example, think that this is the medial border and this is the lateral border of the scapula. So if you see the person from behind, this is the medial border, right? But if you see the patients with the paralysis of the serratus anterior, you can see the medial border becomes prominent. So the prominency of the medial border of the scapula because of the paralysis of the serratus anterior muscle due to the injury of the long thoracic nerve is called as winging of scapula. So winging of scapula is a sign where you can see where there is an injury to the long thoracic nerve in which there will be a paralysis of the serratus anterior muscle. So what are the movements which are affected here? The movements which are affected are pushing movements, punching movements, and the resistance against the wall. Whenever you are performing any pushing movements that is resistance against the wall, you can see the medial border of the scapula as well as the inferior angle of the scapula becomes unduly prominent, right? Not only that, the overhead abduction of the arm is also not possible, right? So by this, I also explained you about the clinical anatomy which is associated with the injury to the long thoracic nerve. So these are the two branches which are arising from the roots of the brachial plexus. First is the dorsal scapular nerve, which is arising from the C5 root of the spinal cord, that is C5 root of the brachial plexus, and the root value is also C5, and it supplies the rhomboidus major and rhomboidus minor, which is responsible for the retraction of the scapula. The second branch which is arising from the roots is long thoracic nerve. The long thoracic nerve is formed by the anterior primary ramine of C5, C6 as well as C7. After the formation of the nerve, it runs vertically downwards towards the neck as well as it reaches the axillary inlet. From the axillary inlet, it reaches the medial wall of the axilla. At the medial wall of the axilla, the nerve is superficial to the serratus anterior muscle and where it innervates the serratus anterior muscle, right? So after finishing, what are the roots which are arising, what are the branches which are arising from the roots of the brachial plexus? Now let us see what are the branches which are arising from the trunks of the brachial plexus, right? So let's have a quick review again. You know that we have totally 3 trunks. So I will write, this is the upper trunk, this is the middle trunk, and this is the lower trunk. Upper trunk is formed by the union of C5 and C6. Middle trunk is the continuation of the C7 alone, and the lower trunk is formed by the union of C8 as well as T1. So if you see the branches arising from the trunks, can you see any branches arising from the middle trunk? No. Can you see any branches arising from the lower trunk? No. So by this we can say that only upper trunk of the brachial plexus giving the branches from the and middle trunk as well as lower trunk are not participating in giving the branches. So by this we can say that only upper trunk is giving 2 branches. So what are the 2 branches given off by the upper trunk of the brachial plexus? The first one is called as the suprascapular nerve, and second one is called as the nerve to subclavius. There are 2 nerves given off by the upper trunk of the brachial plexus. One is called as the suprascapular nerve, and second one is called as the nerve to subclavius, right? So first let us discuss about the suprascapular. So the suprascapular nerve, immediately after it arises from the upper trunk of the brachial plexus, it passes laterally to reach the posterior triangle of the neck. How it arises? After it arises from the upper trunk of the brachial plexus, it passes laterally to reach the posterior triangle of the neck. After reaching the posterior triangle of the neck, it runs backwards and downwards, where it enters the dorsal scapular region through suprascapular foramen. You know that above the scapula, at the upper border of the scapula, near the root of the coracoid process, you can find a suprascapular foramen, right? So suprascapular foramen is actually formed by the suprascapular ligament. You actually have a suprascapular notch at the upper border of the scapula, at the root of the coracoid process. So this suprascapular notch is superiorly bounded by the suprascapular ligament, forming a foramen called as suprascapular foramen. Let's have a rough picture here. For example, this is the coracoid process. Let us assume that this is the coracoid process, and you can say that this is called the root of the coracoid process. At the root of the coracoid process, you can find a suprascapular notch. This is the suprascapular notch. This is the upper border of the scapula, right? This is the upper border of the scapula. This is here you are having the glenoid cavity. So this is the medial border of the scapula, and this is the superior border of the scapula, and this is the lateral border of the scapula, right? So at the upper border of the scapula, near the root of the coracoid process, you have the suprascapular notch. The suprascapular notch is actually covered by a ligament called as suprascapular ligament, right? Suprascapular ligament, right? So this suprascapular, through the suprascapular foramen, after the suprascapular ligament covers the suprascapular notch, it is forming a foramen called as suprascapular foramen, right? So from the suprascapular foramen, the nerve which arises is called as suprascapular nerve. Through the suprascapular foramen, the nerve which enters at the dorsal scapular region is called as suprascapular nerve. And above the ligament or above the suprascapular foramen, it is related to the suprascapular artery. Remember, the suprascapular artery is related above the suprascapular ligament, that is above the suprascapular foramen, and the suprascapular nerve passes through the suprascapular foramen. So from the suprascapular foramen, the suprascapular nerve enters into the dorsal aspect of the scapula. At the dorsal aspect of the scapula, you know, we have the spine of the scapula, right? So the spine of the scapula divides the dorsal aspect of the scapula into superior supraspinatus fossa and inferior infraspinatus fossa. The supraspinatus fossa you have the supraspinatus muscle, and infraspinatus fossa you have the infraspinatus muscle, right? So by the time the suprascapular nerve reaches the dorsal aspect of the scapula, it gives innervation to the two muscles. One is called as the supraspinatus nerve as well as the supraspinatus muscle as well as the infraspinatus muscle. So here I want to tell you that the suprascapular nerve gives innervation to the supraspinatus as well as infraspinatus. Supraspinatus as well as infraspinatus. What is the function of supraspinatus here? I already told you. Supraspinatus is responsible for the 0 to 15 degrees of abduction. 15 to 90 is deltoid. Above 90 is serratus anterior. So the function of the supraspinatus is the abduction of the arm from 0 to 15 degrees. After the supraspinatus, what is the function of the infraspinatus muscle? Infraspinatus muscle is responsible for the lateral rotation of the arm. So supraspinatus is responsible for the abduction of the arm from 0 to 15 degrees, and infraspinatus is responsible for the lateral rotation of the arm. So let's have a quick review. Till now, whatever may be the muscles we studied, one is we studied rhomboidus major as well as rhomboidus minor, retraction of the scapula. Next is the serratus anterior. It is responsible for the overhead abduction of the arm. Not only that, it is also responsible for the pushing as well as punching movements. Next we studied about the supraspinatus, that is abduction of the arm from 0 to 15 degrees. Next is the infraspinatus. It is responsible for the lateral rotation of the arm, right? So till now we studied about the three branches which are arising from the brachial plexus. Now the second branch which arising from the upper trunk of the brachial plexus is called as the nerve to subclavius. The second one is called as the nerve to subclavius. Remember, it is a small nerve. So I will write here nerve to subclavius. Why I am talking that it is a small nerve? Because you know that subclavius muscle is attached to the subclavian groove. Where you studied the subclavian groove? When you studied about the clavicle, in the clavicle, the inferior surface of the clavicle, you have the longitudinal subclavian groove where it gives attachment to the subclavius muscle, right? Which means the subclavius muscle is present immediately beneath the clavicle. So immediately the subclavius, the nerve to subclavius, after it arises from the upper trunk of the brachial plexus, you have the subclavian artery over anteriorly. So it just passes anterior to the subclavian artery and supplies the subclavius muscle. So by this we can say that nerve to subclavius is the small branch arising from the upper trunk of the brachial plexus, and this nerve to subclavius passes anterior to the subclavian artery. After it passes anterior to the subclavian artery, where it gives innervation to the subclavius muscle, and the subclavius muscle is responsible for the stabilization of the clavicle, or it steadies the clavicle, right? So these are the branches which are arising from the upper trunk of the brachial plexus.